Orthodontist here. If you're a mom or dad and you recently took your child to the orthodontist to see if they needed an expander or braces before all their permanent teeth come in, then I'm going to give you a few things to look at to make sure that you feel like you're not being scammed and that it's the right thing to do for your child instead of waiting for all the permanent teeth come in. So there are a few things that I look at as an orthodontist that would say, yes, absolutely, we need to do treatment. I'm on the more conservative side. I like to wait if we can instead of doing 2 rounds of treatment. So things that I look at that I'm like, we absolutely need to do something. One, if there's a crossbite with the back teeth, meaning the top teeth are inside of the lower teeth, then that usually warrants that I'm going to want to do an expander at least to fix that crossbite. That's because that can affect growth of the face and a lot of different other things, crowding of the teeth. So I want to get that expander in there before it's too late. Usually if you wait too long, around like age 12 or even sooner sometimes, depending on if it's a boy or a girl, it can be too late. Another thing I'm looking at is a crossbite with the front teeth. If those front top teeth are behind the lower teeth or they're sticking out really far, we need to fix it. One, if they fall, they can chip their tooth or they could lose their tooth if it's sticking out too far. So we want to fix that crossbite for that reason. And we also want to fix a crossbite in the front. If, let's say, if the tooth is stuck behind, it's not going to allow the face to properly grow. So what you want to do is correct that so that way the maxillary bone and the mandibular bone are able to properly grow. Those are the main things we look for. Also impacted teeth, mainly impacted canines on the top. If they are coming in a certain way, kind of angled like that, we need to try to fix it early. If you wait until it's already a problem, it's usually too late. So if your orthodontist mentioned any of these things or any of these buzzwords, then most likely you should go ahead and continue with treatment and feel at peace that you made the right decision for your kid.